Good morning, everybody. I'm Wendy. I live in Suriname, and Suriname is in South America. And for this session, I'll be presenting on the topic circumcision, a possible HIV prevention tool in Suriname. Some background. The HIV epidemic in Suriname is estimated 1%, but for the general population. But for sex workers, there's a higher HIV prevalence of 6.7 and 5.8 in 2012, and the first case was registered in 1983. We have seen a decrease in the number of HIV cases, but of course that are those that are being tested. So based on the test results, there's an increase, but we are also aware that there might be quite a number of HIV maybe infections that are not registered. Okay. Based on that, there were a number of prevention activities carried out and expanded. Condom accessibility is one of the most important ones. Further HIV testing is widely available. And the integration of HIV in programs.
Sorry to interrupt, Miss Wendy. Sorry to interrupt you. Kindly start your webcam, and your voice is very low. Kindly be please louder.
Okay.
If you have webcam, please start it, please. Share your webcam.
Okay, are you hearing me now? Better?
Yes, I can. Yeah, better than before.
Okay.
Thank you.
So I'll pick up where I stopped.
Yeah, you can start.
Okay. One of the other interventions was to integrate HIV in the program for chronic diseases. So it's not just a standalone HIV program, but it is more seen as a chronic disease. Further, the growth of elimination of mother-to-child transmission program with an increase in the percentage of pregnant women and an increase in testing under HIV women, and we saw a decline in the number of infants born infected with HIV after it was introduced that all the pregnant women had to be tested. HIV prevalence is generally lower in the population than that traditionally practice male circumcision. That is what we found in the literature. And within this context, a male circumcision pilot campaign was implemented in 2009 by the ministry to check what if there are maybe possibilities to introduce that as a possible prevention tool in Suriname. So the pilot was done, but only now I kind of analyzed further. We had some discussion, but I'll just present what we found. Okay, what the method followed is that we invited, through the media, we invited people to come and to register to participate in the circumcision pilot project. Furthermore, healthcare workers were informed. The National AIDS Program distributed specific information about the study in regard to HIV and circumcision to different health clinics, so they knew what would be done. And 500 males were registered, but 444 took part in the study. Now, for age, if you look at the age, 17, the ages of 17 participants were missing because we made use of a survey, and 17 were not registered or did not fill in their age. The youngest male that came for circumcision was a boy, a 2-year-old boy, and the oldest was 22. 86% of participants were between the age of 2 and 14 years. If we look at the ethnicity, Suriname is a ethnic, as a multi-ethnic population. But based on, for example, the census, if you look at the majority of, for example, East Indians in the those that participated, we saw fewer East Indians participating than, for example, what we would have expected. And we saw more blacks and Javanese taking part in the study. And then when looking at the main reason to participate, they answered that they were participating because of hygiene. And furthermore, we also saw that the second reason for participating in the study was because of the religion. Okay. Based on the questionnaire that was administered, we saw that um, they they felt that the circumcision, because circumcision is not really widely done in Suriname, but those that participated indicated that the experience was quite okay. Most respondents consider the procedure painful, but most of them thought that the operation was not very long. The healing process, 75% thought that it healed quickly. And basically, maybe one more highlight. Respondents listed hygiene as the main reasons they would recommend circumcision. Furthermore, we also checked about our knowledge on HIV transmission, and we saw that the 24% the 24% that was 12 years or older, so they were eligible to answer questions about their knowledge. But under that group, we saw that 96% had heard about HIV, but only 54% had been tested, and most likely because of the young age. Only 53 responded knew of the protective effects of condom and in anal sex, and less than 62% of respondents knew of the potential for transmission from infected mothers to infant during delivery. 90% basically knew that HIV could not be transmitted by drinking of the same glass of cup, and 76% said that not having sex was a valid strategy to prevent HIV infection. Based on what we saw, we felt that the information gathered from the study could provide insight into how such program may be improved so as to better reach the target population, because now the invitation was there. People came because they believe as part of an health of hygiene, it is good to be circumcised, and certain religion motivate circumcision. But based on the response that we got, we feel that introducing it like health behavior, people might be interested in being circumcised, and on the long run, it might be an HIV prevention tool. So, future efforts may therefore aim to focus more specifically also on this age group, because they seem to be most willing to undergo the procedure, and the young guys. I think also boys that are being brought by their parents, but young guys that can be maybe make use of the possibility to be circumcised, and of course it can be added to part health hygiene, but also as a prevention tool. Furthermore, schools may prove to be an optimal place to raise this issue, because we also realize that people might know about circumcision, but they do not really make the link to HIV prevention. So, in discussing HIV and also health prevention, circumcision can be discussed. So not only religious persons that because of the religion do circumcision might choose to do that. Religious tradition and practices are important to consider when conducting projects such as this because, of course, certain religious prescribe that. So it's good to know the reasons why they do that. And for example, you can maybe also promote it under that group, as you know, you do it already, but it also have some other benefits. Most participants underwent circumcision for hygiene reasons, so of course they are already interested in doing it for a particular reason, so we can build further on that. The reasons mentioned may offer means through which additional awareness efforts can be made. Relatively few people listed HFE as a reason for participation. We can maybe do more on that because they did not really make the link, so we can make them aware of that. And this indicates that there's little awareness among the public about the potential protective effect of circumcision against HFE. So greater media focus on the issue could help raise awareness and thus raise demand for male circumcision. And on the other hand, we saw that only about 2/3 of the project participants would recommend it, even though they were positive about the experience. So I think that effort should be made to identify and address the reasons why it might not be recommended, so as to ensure further future participation and compliance. So I think this recommendation can be given to the National AIDS Program, that based on the results, they can pick it up and they can also look at what the reasons were that people would not recommend it, even though they had indicated that the experience was a positive one. It might also be prudent to devise methods for assisting those who would recommend the program in actually doing so. For example, mail invitation, but also through WhatsApp and that are ways, and maybe by giving them a coupon or an incentive to refer other men to be circumcised. Based on the available results of research done and the pilot carried out in Suriname, it is recommended that the National AIDS Program looks into the promotion of circumcision as part of a healthy lifestyle. That are my references. I would like to thank you for attending.